the duration while we're talking, so no one gets distracted. If they have ADD as bad as me, that will take the focus off everything.
I like that.
We're all here for one reason. You know, we're trying to find out the truth about health and how we can avoid all the, horrible end-of-life interruptions that unfortunately 5 out of 6 people experience every day. My name is Andrew. I'm actually a patient of Tony's. I believe in him more than anything, and I'll just share my story with you quickly, if I can. 3 years ago, I'm pretty sure that there was nobody in this room who I would either talk to or want to talk to me, being the person that I was. I was miserable, I was unhappy, I was unhealthy. And my ex-girlfriend used to work for Tony, and she asked me to come in one day for a visit, telling me all these miraculous, amazing things that he could do and how he helps people day in and day out. And I told her, I said, listen, I hear this all the time, I see it on the infomercials, this and that, it's gotta be a crock. There's no way. So I go into the office, and 2 weeks prior to this, I started having these gallbladder attacks. And they would literally drop me to the floor. Now I'm your average, everyday tough guy. I don't ever let anybody see my pain I'm in. I don't ever admit to anything. And it was very uncomfortable because it made me feel vulnerable. And I had a very dangerous job at the time, and it was really, really, like harming me at work, stopping my production and slowing me down. So I went to go see Tony. I believe it was my first or second visit, and I actually had an attack right in the waiting room. And I flew right out of the chair, I hit the floor, I crawled into a fetal position, and I was in complete agony. I mean, I couldn't even move. So my girlfriend at the time had ran in and got Tony, and he came out. He said, listen, relax, calm down. I promise I can help you, but I need you to do something. I need you to believe in me, I need you to believe in God, I need you to believe that your body is designed to heal from this. So he was asking me to do 3 things that I hadn't done pretty much my entire life, all in an instant. And at that moment, something came over me and I was able to surrender myself. And I was able to, just do whatever I needed to do to get this up because I couldn't take it anymore.
It's called pain.
Yeah. So as I turned on my side, Tony had put his hands in somewhat of like a CPR formation on the side of my neck, and he says, I'm going to give you a toggle adjustment. It's a very powerful adjustment, and like I said, as long as you maintain faith, I promise this will work. So he adjusts me, and I felt this incredible heat, like this energy, just from the top of my spine all the way down through my feet. I mean, like this, and my feet actually moved. That's how powerful this was. And instantly, the pain had gone away, the discomfort, instantly. And I went to get up, and he says, no, don't get up, don't get up. You're gonna be really, really tired. Just stay there for a minute for me. I immediately went back to, tough guy mode. No, I'm good. I appreciate it. I want to sit in the chair. He says, no, just give me 1 minute. I promise. You're going to be really, really tired. Make a long story short, I woke up 3 hours later in the same exact spot on the floor. I canceled the surgery that I had scheduled for 2 weeks later. They're going to remove my gallbladder, and I still have all my parts. Thank you to the wonderful man that we all came here to meet, Dr. Tony Sayegh. Please listen to everything he has to say, because if he can change your life the way he changed mine, I promise it'll be nothing but beneficial to you. Thank you very much.
Guys, I want to take a time to just thank you all for coming out in the snow blizzard, really crazy ones. Andrew, thank you for that nice story.
Thank you.
I want to share a story with you guys. I want to introduce you to someone who's with us today, who was actually, some of you guys are my patients, right? But everybody, as a doctor, there's certain times there's people that will go ahead and they ask you for advice and say, oh, what do you do? What should I do? What should I do? And then there's always that guy that'll ask you, oh, what should I do? What should I do? And never do it. I'm going to tell you about one of my worst patients that I've ever had today, and I'm going to introduce you. I'd like to introduce you to him because he's with us today. And the point is that he's a friend of mine, and he's also a doctor, And he started, as doctors, a lot of times we feel like we already know everything. We fill our heads with so much educated knowledge, and sometimes it makes it hard to see the simple things. There's a scripture that says that simple things are placed here to confound the wise. And it's easy to get into that pattern sometimes. So he started having a hard time breathing. And sometimes you just to kind of get yourself centered, you just take it. Everyone, take a deep breath for a second. Nice and slow. Feel that breath go in, all the way out. Let's do another one. All the way in, and all the way out. And one more. Really let yourself just enjoy that breath. Sometimes you don't enjoy something until you feel like you'll lose it. Because he couldn't do that. He couldn't take a satisfying breath. He had shortness of breath. And he would go ahead and for sometimes over an hour, he'd be sitting there go, and he's getting air in, and he didn't think that he was gonna, have to be rushed to the hospital or anything. But the point is, if you ever suffered shortness of breath, or you know anyone who's ever suffered shortness of breath, you know what that's like, and you just can't get that breath. Well, what happened was, he told me about it, and I said, hey, you know what? We got to find out. Let's take a closer look. Let's see what's going on. What might be causing that? And what happened was sometimes it would just go away, and then sometimes it would go away for a couple days and come back. And so he lost any sense of urgency with it, because it would come and go, and he said, no, it's not a big deal. So then a little time goes by, and he ends up having this little rash that kind of came out on his skin, and it was so small. It was like you really had to look close at it. And he says, look at this. And it was weird because he never ever had any problems with his skin before. And he had this little rash kind of like on his forehead and on his back. So he wanted to know what was going on. I said, hey, that's a sign. Usually when your skin has an eruption on the outside, there's a sign of something not going on right on the inside. This is the second time now, second level deep, and I'm like, we really should go ahead and find out what's going on with that. And because it was not that big of a deal and it was not that hard to notice, it's not a big deal. He was too busy. He had too much to work on. He was busy focusing on his practice. He was, like I said, he was focusing on so many things. He was so committed to his family. He had all these other things. And his health was important to him. But his priorities were a little bit off. And what happened is it progressed. Things tended to continue to break down. Anyone here know anyone who, you started off with like just one thing, and then all of a sudden another thing ended up going on, and it just, you can tell things are just moving in the wrong direction? Well, that's what was going on with him. And the next thing, he started having elimination problems. There was so many problems. I'm not going to discuss every single issue that came up with him, but he went through tremendous suffering. That's why I want to introduce you to today, because he came out on top. See, he started having to go literally like to the bathroom 6-10 times a day. That's when it started affecting his work. But he just did the bare minimum. And the reason he did the bare minimum was because, in essence, he still overall was feeling pretty good, and he looked pretty good. He looked healthy. He felt healthy, and at the same time, you never think, something bad's going to happen. You never think that. Even if you really do think that, you don't want to think it. You just block it out, right? Don't we do that? And so what happened was, it actually took a turn for the worse. And the whole time, I'm telling, hey, we need to find out what's causing this. You kind of not just do the bare minimum and keep patching it up and keep yourself going. And he's so focused on, oh, I have so much work to do. I have to do this. I'll do it. That's what he said. He goes, I'll do it, but first, let me do this. Let me just get this done. Let me just do that. Worst patient ever, man. And he goes ahead, and it took another turn for the worse. See, what happened was he started realizing he was hemorrhaging. And that came and went as far as what he was able to see. Come and go, come and go. And he still wasn't making his health his priority. No matter what it is, that I could do or say. And then finally, all of a sudden, right, like quote unquote, out of nowhere, it struck. And just like that, he was in agonizing pain. He went out to the city with his wife to a comedy club. See, he was feeling great. He was feeling good. He went to this comedy club, and then all of a sudden, there was this huge shift that just took place. And he was on his hands and knees on his bed, praying that he wasn't going to die that day. And when he went ahead and did all the medical reports and check out, that the day that he did that, one of the doctors went out because he knew him and bought him lunch and talked to him and the other doctor, and they told him what was going on, and he heard that he had all these tumors growing out of control, and he was told that day he had cancer. And his body just wasted away. See, a month went by, and he lost about 20 pounds, and then another month went by, and he lost more weight, and it got to the point where, he couldn't work anymore. He couldn't provide for his family. He was having sleepless nights. The worst part is that he didn't want his kids to see him that way. Anyway, a huge shift took place. He heard what health was, but what happened was, it's like a light bulb hit. When you get humbled by life, when you get humbled in certain ways, it makes the space. It makes the space for something new, to be deposited in your head from something greater than you because you're being humbled. And a light bulb went off, and he finally understood what true health was and made a commitment. It was from that humility came this faith that just became so clear to him, and he made that commitment. Turned his whole life around, saved his life, and now he's a better doctor than he's ever been. He's wanting his message. He just wants to. He's really, the truth is, I want to introduce you right now to the biggest dummy that I ever had to take care of, and at the same time, he really just loves people and wants to make sure that never happens to them. Yeah, you're looking at him. Some of you guys have been my patients during this time. I have my father here today. This information, when it finally hit me, and I finally got the big idea, and I saw how we were created and how things happen, all of a sudden it became simple because there was so much stuff. See, when you don't understand what health is, it makes it so confusing. And you go on the internet and you just see everything. You see all these different choices, and there's 1,000 different definitions for what health is. When you ask 90%, when you ask most Americans, how do you know when you're healthy? What kind of things do we base our health on? What do you think that most people say? Excuse me? How you feeling, right? When you're feeling good. What else? Your looks, right? If you go ahead and you look at the cover of a Men's Health magazine, you can see someone who looks good, right? We get these models, right? People who look good and feel good, right? Different people's definitions. I know your definition of how you base your health on is really, you can tell by your actions. There was a gentleman that I knew who brought his daughter, wanted us to take care of his daughter. She had allergies. And anyone who's a patient of mine already, you know that we don't treat allergies. We go ahead, and if your immune system's not working right, we want to build your health up until your immune system's not overreacting to anything in your environment. And by definition, you're not going to have any of those allergic reactions anymore. But the father, we said, he had high blood pressure, and he's on high blood pressure medications. And we said, hey, you got to really find out what's causing that. Why are you having that happen in your body? Because he was on blood pressure medication. He said, oh no, I'm fine. He said, just take care of my daughter. And we said, well, I'm not really sure. There's definitely a part of your body that's not working right. There's damage somewhere. That part of your body that controls your blood pressure. And he's like, no, I just went to my doctor. I got my blood test back. I got everything's fine. My blood pressure's under control. See, his definition of what health was, some of you may have heard of this guy. Anyway, his definition of what health was, well, if my doctor says things are good and my blood tests are showing up normal, then I'm healthy. And That's not what health is, though, because if your body is breaking down and things are failing, or they're failing to do their job, if there's parts of his body that are breaking down and you don't find out what's causing it, so he was at his daughter's bat mitzvah. Did I pronounce it right? Bat mitzvah, and he was dancing on the dance floor, and all of a sudden he started to feel numbness and tingling down his left arm. And he looked over at his wife, and his wife saw the fear in his eyes, because you know what that is, most of you, right? You know what that is?
Sure.
It could, sometimes you could, right? It was a heart attack, though, okay? And the thing is, he never made it out of the hospital. So when I had that huge epiphany and I learned what health truly is, that's what saved my life. That's what changed everything for me. That's what, I almost wasn't able to be there for my third daughter to be born. I almost wasn't able to watch, I have 3 little girls, and I almost wasn't able to watch them grow up. I was wasting away, getting thinner and thinner. My father was scared. Over there. Because there was a point where if I stayed on that path, I wasn't going to last the year. I wasn't going to last the next 9 months, or it was going to be less. I was wasting away. And I had waited so long that I was so skinny. Some of my patients have seen pictures of me or seen me during that time. Peter, you've seen me during that time? But I was so thin, I was emaciated, I was so weak, I was in so much pain, that even if I did chemo and surgery, if I did the surgery, the solution that was being offered to me wasn't much better. You know, if they cut out my whole intestine from here to here, which is what they wanted, I don't know if I would have a bag or something. But the point is, it's just not the way I wanted to go. That's not what I wanted to do. And if I didn't learn what true health was, by learning what true health was, that's why we're having this meal here, that's why we're reaching out to people, that's what changed my history, the path that I was on. And I know without a doubt that when you learn this information, it's going to change your life too. You'll never look at health again. And the thing is, it's just simple stuff. We're going to share stuff with you. It's the same. It's been going on since 7,000 years. It's the same. So, well, we know health isn't just about making sure your blood tests are normal, right? See, if you want to, what I want to do is I want to help everyone here and everyone I meet be able to go ahead, and if you want to be truly healthy, you got to know, like, what's the top 3 things that are robbing people of health. You got to know what the top 3 killers are. So the number 1 thing is, the number 3 cause of death is heart disease. Heart disease kills right now over 500,000 people, about 550,000 people last year, okay? And I don't know if you guys know this, but the very first time, 80% of the time, when you have your first signs or symptoms that you even have heart disease, that means there's damage in your arteries or the vasculature or your heart itself. There's the very first sign or symptom, a lot of times, just like the gentleman I was just sharing about. The very first time, 80% is you're actually having the symptoms of a heart attack. And 2/3 of those people die. So one thing I can tell you what health is with certainty is that it's not how you look and it's not how you feel. And if you're basing your health on how you look and how you feel, it's too late if that's what's going on. And then you have you have cancer. Cancer kills about 700,000 people. I remember the day that they told me that, and at first I had this wall up, and I felt like, you know what, I've helped people heal from stuff like this before, and all these things going forward. And then I went home. After that dinner with that doctor brought me lunch, and I went home, and then I fell down to my knees and I cried. I was 35 years old. I ate, I took my vitamins, I did certain things. I didn't fully understand what true health was. And here I was, about to have my father outlive his son. Man, my family's been through some tough times. My brother had a stroke at age 30. So, I don't understand how he didn't get my father a heart attack. But all of this is, when you go ahead, all the suffering I've been through, when you finally understand what true health is and you see what your purpose and mission in life is, you feel the two best days in your life, right, Andrew, are the day you're born and the day you find out why. And I found out why. And I know what my purpose is. And it's to help save lives by teaching people what true health is. So the thing is, when you go ahead and you have to understand what a symptom is. The reason we had you guys fill out those stress surveys is because a lot of you don't know this, but all the research shows when you have a symptom, when you have something, the first time you're actually feeling or seeing something wrong with your body, you're already down 40% dysfunction, damage, or cell death of some type of organ, cell, or tissue in your body. See, it's obvious something isn't functioning right. So if something's not functioning the way it was designed to, the way it was created to, and we just go ahead and you have a symptom, you're having, especially what happens when it becomes chronic, we know something's breaking down. You're down to at least 60% malfunction, damage, or disease, and you know what we're told to do? What are we told to do?
Have surgery.
Medicine, surgery. Now, is that taking care of the problem? You understand? Is that taking care of what's causing it? Is the cause of a problem ever a lack of? Did lack of aspirin cause a heart attack? Is that why people have damage and building up in the arteries? I mean, is it ever a lack of medicine that caused people to get sick? Maybe we should have all the kids go on all the medicines so this can keep them really healthy. Or is there something else going on there? Something else causing breakdown? So we mask it. We mask it. And all the time while we're masking those symptoms, our health, things could be breaking down in the body. Things could be breaking down. If you're sick, if your body doesn't have enough life, we're going to go over a second exactly what health is. But if you don't have enough life, if your body's not doing what it's supposed to be doing, your body's not renewing itself the way it's supposed to be renewing, things are breaking down. There's damage happening. And the whole while that more and more damage is happening, you start having more and more symptoms, more and more things malfunctioning. And eventually, if everything's breaking down, that includes your arteries, we end up, look at the 550,000 people, stroke or heart attack. Because you end up, things are breaking down. Or with cancer, that organizational intelligence that's inside you can't be expressed. Okay? Your immune system's not destroying cancer cells anymore, not as effective as it's supposed to be. See, if your immune system was destroying keeping all those cancer cells at bay, everyone gets them. But the point is, if your immune system was keeping them at bay, would you go ahead and end up getting that diagnosis of cancer? My uncle died of pancreatic cancer. And when you go ahead and you research and you find out what the best doctors in the world have to say about it, and it was Johns Hopkins University, they say that pancreatic cancer, which by the way is one of the fastest growing cancers you can get, one of the scariest ones, they say that it's grown for an average of 13 years before you ever even noticed your first sign or symptom. 13 years, 12.7 to be exact. You go through different life experiences and you can't change how you dealt with certain things in the past, but everything helps you become part of who you are. Help me become part of who I am. And this is why we're doing these dinners today. Because people don't know this. They don't know. We're always basing our health on how we look or how we feel. Health, if you look in Dorland's medical dictionary, it tells you, any dictionary, any doctor, you just ask them, it's everything functioning the way it's supposed to be. If you look in the medical dictionary, it says health is to the optimal function with everything functioning at 100% consistently, not merely the absence of sickness or disease. God bless you. And it mentions physically, mentally, socially, and spiritually. So if you want to know what health is, if you want to beat the top 3 killers, does anyone here want to see how to beat the top 3 killers with predictability, with certainty, would be able to, there's hope. Even all research shows that 5 out of 6 people in this country right now have that process already going. 5 out of 6 deaths in this country right now are heart disease and cancer. I mean, we go ahead and we look and we see, what are these people? What are the people we care about dying from? Anyone here know someone who passed away recently from cancer? Or, yes, thank you, heart disease? I mean, this is real. This is us. And anyone who's basing their health on how they look or how they feel, it's the research, it's 5 out of 6 of us. We have this process going on in our body. Nobody ever gets told they have cancer and the doctor says this happened overnight. It's been growing for years, 20, 30 years. I have a friend of mine whose father, they found a 10-pound tumor growing on his kidney, and it was pushed on his stomach. And his only symptom that he was feeling was he wasn't that hungry and he was tired. But it was an abnormally way. He recognized something was not right. He was tired all the time, and he just didn't have his appetite. But that wasn't a big enough deal. See, he wasn't taught about how symptoms mean something is malfunctioning at least 40% or worse. And he took his time, and what happened was eventually he went ahead, they found that 10-pound tumor. They cut it out, and a few months later, I forget how many months, it was like 4 or 5 months later, it spread everywhere, and he died. And the doctors told him with that cancer that he actually died 30 years earlier, because that's when it started growing, he said. So the point is, the whole time while this is a friend of mine who works out a lot, and he said, but every time my dad was taking me to the gym and working out, he said, my dad was dying of cancer and nobody knew about it because we didn't know, and that's part of what inspired him to start making a difference for him. And right now, he's actually, in his family, the women have fared better, right? But in his family, he's going to be the first in 5 generations to actually see his grandchild. That's how bad it is. He's going to be the first in 5 generations. And he was on that path. See, he was basing his health on how he looked and how he felt, and he was on that path. But now he knows what it takes. And we're going to share that with you. We want you to know exactly what it takes too. Because I want you to be able to see your children and your grandchildren. Or whatever it is. It's not even just about your health. Your health is there for you to accomplish whatever your purpose is. You can't, whatever you were created for, whatever it is you're meant to do, can you do it without your health? Can you spend the quality time that you want to spend? Can you do, can I take my kids ice skating? Well, I can tell you this, when I was feeling sick and I was in bed all the time, I couldn't do anything. So we want you to know how to do that with predictability. And there's hope, because all the research, not only does research show that 5 out of 6 people have that process going on already, but research also shows that it's only 2% of it is truly genetic. We're always told, oh, it's your age, or it's your genetics, oh, it runs in the family. Or it's, if you were born with something, when I had a patient with Down syndrome, that's genetic. When you're born with something and you have a malfunction right from birth, fine. You have an argument there. But when for the last 20, 30, 40, 50 years of your life, everything was functioning perfectly normal, and then something changed. Now, it's no longer functioning perfectly normal anymore, and you're suffering. And it's causing more problems, or maybe you're not even suffering yet. But the point is, something changed. I guarantee you it wasn't your genetics. And yet your genetics provided for so many years of your life for things to change, and nobody's taken the time to look at what changed. I'm so thankful that I got the idea, and I heard things over and over again before, but it took something, I guess, you know what? Sometimes I feel like God just has to hit you over the head or something. Sometimes just to listen, because it took me being humbled and going through as what I did before something finally sinked in and it became clear to me. And then I made a commitment. I mean, my life was on the line. I was on my deathbed. I couldn't do anything anymore. I put everything else above my health. I had my priorities all messed up. So anyway, if you want to know what health is everything functioning the way it is. You got to look at what controls your function. That's the only way you got to be healthy. Whatever it is that controls that function, don't you have to look to that and make sure that it stays doing what it's supposed to be doing? And for how long do you want it to do that? Excuse me? Who said that? You? For the next 1 year? The next 5 years? Harvard University studies show that your body was created to be able to be healthy and renew itself. You have enough life stored in your brain to keep renewing your cells for up to 120 years. You've heard of that study?
Yeah.
So the point is that if you do you guys know what do you guys know what organ controls everything in your body? Your brain. Your brain controls every single thing. And there's times, how many people here know someone who was having symptoms, they were suffering, they were struggling with something, and it didn't show up in blood tests yet. And they kept doing all these different tests, and they kept saying, doctors can't find what's wrong with me. Anyone here?
Yeah.
Yes, that happened to you?
Yeah.
And they go ahead, see, because you can have your health decreasing, you can have, see, what happens when your brain shuts down? What happens if your brain shuts down? What happens to every other organ? It's going to start to shut down. It's called brain dead when your brain shuts down. If there's no more signals coming from your brain, that's it, you're dead. You got it? So the point is, yeah, you can sleep, but your brain never sleeps. It's constantly working, keeping your heart beating, keeping your lungs breathing. You got it? And how does it do that? When you have food and you eat food, it digests it. I had huge tumors cut in my intestines. I couldn't get anything through. So the point is, there's so many people like that, and if these signals cannot get through here, right? And let's just say, see, if I just cut this right here, or if I cut the nerves to your heart, what's going to happen to you? You die. But let's scale it back a little bit. Okay, this is what many people don't know. This is what health is. If you know those magazines on health, you see the models and everything we mentioned before. This is the true picture of health. This is how God created your body to function, heal, and operate. This is how your body develops and how it controls everything that's going on in your body. Gray's Anatomy states that every medical textbook, every medical doctor knows that this is what's going on. And really, a lot of us know. I know we learned it in school, sometimes we forget, but we know the brain controls everything. And the point is, if there's an irritation on that nerve, if there's a blockage on that nerve, if there's something, it's not completely blocked, but if something's irritating that, if you took the weight of a dime and tied it to the nerve going to your heart, what's going to happen to your heart? You know? What's going to happen? Anything is that something, do you think that's a good idea to leave a block? Is there ever a good time that it would be to leave a blockage like that? What if you're 80 years old? Do you think that would be, well, I'm already 80 years old, I'll leave it there? No? So the point is, your nerves are very delicate and they're sensitive. And it controls your immune system. When there's interference in the signals, you have to know what's going through there. That power that's flowing through there, when was that power put there? Did some doctor put it into you? Do we have to look outside of ourselves for health? What, were you born with it? You're born with it. That's your gift to you from your Creator called life. And the minute that that power shuts down, you shut down. And when that power is being interfered with and it's not getting to every organ, every cell, every tissue of your body, it's a law like gravity. If I take this pen over there and I throw it up in the air, what's going to happen? Every time? Every single time. Okay? This is common knowledge, right? It's a law. I know with certainty that if there's anything putting pressure on those nerves, anything, one of the biggest ways that we can have interference or blockages is due to the one thing that's there to protect your nervous system. It's kind of interesting. Because it's there to protect you. It's called your spine. Your spinal cord goes right through here. Okay? And it's supposed to have certain curves here. Alright? The most important one is the one right by your neck because your brainstem. Can you feel, if you put your hands on your head, can you feel right down, if you slide your thumb down behind your ears and you feel that bone where it ends? Yeah, feel that spot. That's the spot that controls your blood pressure. It controls your heart rate. It controls your pH, your respiration. You want to feel that area. If you don't, a lot of people, that area is very tender, tight. There's muscles putting pressure on there. Anyone here think the nerves aren't delicate, that you want it just, if you had a nerve exposed, that's okay? I'm telling you right now, if you have something like that, and there's pressure on that brainstem, it's a law of life. There's something going on, it's going to cause things to break down. Guaranteed. It's a law. And every medical study that's been done on this, when you start to lose those curves in your neck, when you have the abnormal pressure, I know Andrew, I was going to bring this, but Andrew brought it. Good thing you did, I guess it's supposed to be, okay? When you go ahead and you have too much, anyone know what this is called here? Excuse me? Yeah, but when you have like an abnormal curve like that. Very good, very good. But anyone here heard the word scoliosis?
Yes.
You know? And what will doctors do for that? Did you know the average kid with scoliosis, even after the surgery, if they had it really bad and it's getting worse, they'll put in surgery. Because it's putting too much pressure, it's going to shut down organs. And still, the average kid with scoliosis has about 14, 15 years less life. And then the truth is that every study ever done showing on any time you have too much or too little of the curves in your neck, when you lose this curve on your neck, it actually squishes the spinal cord, it stretches it, and it crushes it, it smashes it in. And it's pulling on the brainstem. And if that's going on inside you, are you healthy?
Nope.
Well, guess what? You can't feel that most of the time. Let me give you an example. Look at Christopher Reeves, for example. Christopher Reeve is someone who is really like someone who I have a little bit of a connection with, only because he spoke at my high school graduation. Dad, do you remember that? So he spoke at my high school graduation. And Christopher Reeve fell off a horse. Does anyone here not know who Christopher Reeves is?
Superman.
Superman. That's right. So Christopher Reeve went ahead and fell off a horse. And he broke this bone. And if you read his book, he talks about how when they found the damage was about 1 centimeter's worth of damage, like my little pinky fingernail. Okay? Worth of damage on his spinal cord. It wasn't much. It wasn't that deep. Okay? And what happened to him? Everything, see, it's a law. We know with absolute certainty that if something cuts pressure off over there, things are going to shut down. He had access to the best, he had all the money in the world. He had access to the best doctors, the best technology, the best equipment, the best facilities. But in 7 years, he ended up moving on. Okay? And it's before his time. Because is there anyone here who think, of course, anything could happen, but is there anyone here who thinks that Christopher Reeves didn't have the opportunity to still be alive today if he never had that injury to this part of his spinal cord?
Yes.
He'd probably still be alive today, right? So the point is that he had this injury, and what happened was it was blocking flow of this power to the lungs. So his lungs stopped working, so they hooked him up to a respirator. Do you understand? His heart stopped working right. They didn't want him to die. They gave him a pacemaker. His intestines they started shutting down. See, little brother, he was just dying. Now, the whole time, he was feeling okay. Obviously, in the very beginning, when he had that break, he was in pain. But the whole time afterwards, when he spoke at my graduation, he gave the most inspiring speech. And he's someone who I can tell was humbled by the situation. And normally, that's the person you're rooting for to go ahead and heal. But there's certain laws of life. A law is a law is a law. It's just the way God made your body to function, heal, and operate. If there's something putting pressure over there, it just can't happen. That's why do so many good people get sick? A lot of times, most of the time, this is what's going on. It needs to be checked. You can't feel it. So Christopher Reeve didn't feel anything. He gave the most inspiring speech, and eventually, within 7 years, he ended up moving on. In the meantime, there's another gentleman by the name of another famous person, Dennis Byrd. Do you guys know who Dennis Byrd is? He was a New York Jets football player. He had a similar injury right in his neck, and they said the same thing for him, and he'd never be able to walk again. But in his particular situation, he had a different influence. They went ahead and they made sure that there was no pressure on it. There was pressure on there, that's why he was paralyzed, but they took it off before they just went ahead. See, with Christopher Reeve, when they did the surgery, they kind of made it a permanent subluxation, is what you said. A subluxation, sub means less, lux is life. It's just like ation is a condition of. It's a condition of less life in the body. You had less than your God-given normal, not 100% anymore. Okay? So what happened with Dennis Byrd was they took that pressure off, and 3 months later, he was taking steps. Right now, you would never know anything was ever wrong with him. And he wrote a book about it, and it's called Rise and Walk, The Dennis Byrd Story. The difference between life and death was right in there. So when we go ahead, and even though I was taking my vitamins and I was exercising, all right, if that power that controls and coordinates all cells, functions, tissues in the body is not being expressed, do you think I was absorbing all the nutrients and utilizing it properly? Is it possible to do 100% of what my body's supposed to be doing when the signals that are controlling what's going on are not getting through? When my body's not renewing and replacing itself at 100%? When I had those tumors, the doctors told me those tumors would never go away like that. I had to do the surgery. They wanted me to do chemo. I never did the chemo. And I was scared, even knowing what I'm doing. When you have so many, there's so much certainty.